Hi everyone, I'm Nick and I'm the CEO of NIQS Tech. At NIQS, we believe that managing diabetes is a basic human necessity. Our mission is to provide user-friendly and affordable alternatives for glucose monitoring. And we're doing this with our truly non-invasive, accurate, and continuous glucose sensor. That means no more needles and no more blood. Now, as I'm sure a lot of you are already aware, diabetes is a significant and global issue. Currently, there's around 463 million of us living with the condition. To put that into context, that's 1 in every 20 of us. Research indicates that over the next 25 years, this number is going to almost double to 700 million, or 1 in every 10 of us. When we conducted our market research, we spoke with experts who told us that current glucose management technologies are not conducive to effective diabetes management. In fact, what we need are more effective management technologies that will help us to reduce the impact that diabetes is having. Currently, there's 2 ways to measure glucose. The first are finger prick tests, which use needles to draw blood samples, and this needs to be done between 5 to 10 times per day. As technology has progressed, we're now seeing continuous glucose monitors, or CGMs. These use thin invasive fibers inserted under the skin to make measurements, but need to be replaced every 7 to 14 days. Now, while these technologies are capable of glucose monitoring, they're not suitable for everyone. That's because they're invasive, painful, not cost-effective, and they're not reusable. So what we need is a solution that answers these unmet needs. This is NIQS's non-invasive glucose sensor. Using a novel optical interaction, we can make a glucose measurement in around 30 seconds simply by being in contact with the device. That means no more needles and no more blood. Over the next few years, we aim to launch 2 next-generation products: a handheld point-of-care sensor capable of intermittent sensing, and a continuous wearable sensor that provides dynamic information on how glucose levels change over time. Now, to protect this technology, we have 2 patents. The first patent has been filed and granted in several key territories, and it covers the manufacture and sensing application of our novel sensing material. The second patent we aim to file during our upcoming funding round. This will cover the sensor design and the novel sensing mechanism that enables us to make measurements. In both cases, these patents are owned by our host institution, the University of Leeds, where NIQS has been granted an exclusive license with rights to assignment upon raising £2 million in funding. So what is the market opportunity? Our total addressable market is based on the number of people living with diabetes worldwide. Globally, this market is worth $13 billion and is predicted to rise to $26 billion over the next 5 to 6 years. Our focus is working with healthcare providers, meaning that our serviceable addressable market is derived from the number of people living with diabetes who have access to free healthcare through a healthcare provider. And based on our connections to the NHS and our location, our serviceable obtainable market will be the 5 million plus people living with diabetes within the UK. Finally, we've had some very positive responses from the NHS on this, who helped us to further validate the market. Next, I'd like to introduce you to the team driving NIQS forward. Our team consists of expert scientists who have experience commercializing academic research and have received business training through the RSE program. We also have strong support from an advisory board, which have expertise that range from the science behind the technology through to the clinical and trialing aspect of it. I'd also like to take the time to give a special shout out to my RSE mentor, Dr. Ian McEwen, who's been extremely helpful and supportive over this last year. Finally, I'd like to share with you our progress. Over the first half of the program, we were focused on building and refining our pitch decks and business plan, which was followed by a long and difficult negotiation on our IP license. As of last month, NIQS has successfully been spun out of the University of Leeds, and we've recently been awarded a 500k Innovate UK grant. Our focus now is raising a 350k seed round alongside this grant, and over the next year, we'll be focusing on prototype development and in vitro trials to gather supporting data for our technology. With that, I'd like to thank you for your time and open the floor to any of your questions. Thank you.